I think
Thanks, Jane.
no problem.
Well, good morning, everyone. I'm Kevin Coleman with Excelis. I handle our group Medicare plans in the Syracuse and Utica regions. I'm gonna go through this plan today. We'll go through some of the basics of Medicare. And some of this may be familiar to you, because you might already be on, but we like to cover it right from the beginning, ground up, build from there. So I have about not even 20 slides to go through. Maybe it'll take 20 minutes or so. And then I can open it up for questions and see if you have any questions on the plan or, plan design, co-pays, whatever it might be. All right, so when we start, as I said, we like to start with the basics. This is what we refer to as original Medicare, Part A and Part B. Part A is your hospital coverage. Your, covers skilled nursing, things like that. So Part B is doctor's visits, outpatient visits, anything like that. Part A, you don't pay a premium for because you worked for 10 years or 40 quarters, paid into it. So a lot of times people say you get it free. I say you prepaid it, right? Because it was coming out of your paycheck every week. Part B, you do pay a premium for, and that premium in this year, 2025, is $185, projected to go up to $206.50. CMS, the Centers for Medicare and Medicaid Services, hasn't released that information yet. They think this is what it's gonna be. I think maybe that's getting delayed because of the shutdown and everything, so we'll see what that ends up being, but it typically goes up a little bit every year. So that we refer to as original Medicare. That's your red, white, and blue card that you have that shows your effective dates for Part A and Part B. And you apply for that through Social Security. Guessing since you're on this plan that you're on now, you've already got that in place, but
Comes right out of our checks.
comes right out of the checks, yeah. Yeah, and that's a good point. If you're collecting Social Security, they automatically deduct that. If you weren't, they bill you quarterly for it. So if you have some of your guys that you say, you're taking the lead for, if they, yeah. So what we're gonna talk about here, this plan is a Medicare Advantage plan, which is Part C of Medicare. So A was hospital, B is doctor's visits and outpatient. C is the Medicare Advantage plan that takes all those rights and benefits of A and B. Can even include Part D prescription drug, and this plan does. So it kind of wraps it into one neat little package. And the way it works, the Medicare Advantage plan kind of replaces original Medicare. You still have it. You're still paying your Part B premium, but it's incorporated into the Medicare Advantage plan. So right now, you show your Medicare card, you show your insurance card, right? And you've got a separate prescription drug card, or is it included in the one? It's included. Yeah, so, yeah, but I know it's a lot of different tiers and stuff, but with this plan, you only need to show the Medicare Advantage card, whether you go to the hospital, the doctor, or the pharmacy. Red, white, and blue card, you can leave at home now, you don't need to show it. Morning,
Good morning.
how are you?
I'm good, thanks.
Good. Feel free to.
I'm just gonna stand. I'm good. Thank you.
Okay, alright. So it kind of replaces it, even though you still have that red, white, and blue card that's still in place, leave that safe at home. Alright. So if we go through some of the plan design here, we'll look at preventive services. You got a zero copay. A lot of things are covered in full. Diagnostic tests, routine exams, mammographies, pap and cervical cancer screenings. And a lot of what I'm showing here in the booklet, you'll have all of that. All right, yeah. There's a whole summary of the plan design in there. Bone density screenings, prostate cancer screenings, and a routine hearing exam, also a zero copay. If we look at primary care visits, specialist, And again, with this plan, you don't need to identify your primary care physician. You don't need to get a referral to see a specialist. You can go to anybody you want, anytime. Zero copay for your primary care and specialist with all these visits. Urgent care is a zero copay, and that's covered worldwide. Actually, urgent care, ambulance and emergency care are all covered worldwide. So any MRIs, CAT scans, PET scans, still zero copay. X-rays, outpatient services, you go in and out for a same-day surgery, also zero copay. Chiropractic care, zero, and Part B medical drugs. There are some drugs that if it's injectable or infusion or administered by a medical professional, it'll fall under Part B. Still a zero copay for those drugs. I mentioned the ER is a zero copay in inpatient hospitalization. Zero copay, and there's no limit on the number of days per stay. Cardiac rehab, PT, OT, ST, your physical therapy, speech therapy, occupational therapy is zero copay. Diabetic supplies, zero. Out-of-pocket max, zero. So you can see, this is a very rich plan design, right? Nothing's coming out of your pocket yet. Yeah.
The PTOT, ST. That's in the office, or can that be at home?
It's different if it's home, it's in the office, but we'll get to the home part here in a minute. Out-of-pocket max, and then there's some extras. These plans, these advantage plans allow us as the carrier to add in some additional benefits. There's an eyewear allowance of $300 per year. This plan actually has a dental benefit, it's an allowance. $500 annually for class 1 and class 2, so your cleanings, exams, x-rays. Class 2 is like fillings. It's not gonna cover, you know, you can't apply that, I should say, not cover it, because it's an allowance, but couldn't apply it toward, you know, dentures or bridges or anything like that, but class 1 and class 2 services. True hearing, the hearing aids, I got a separate slide on, I'll come back to that, as I will Silver and Fit, which is a gym membership program, separate slide. And there's the home health care, also zero copay, so that's if you had a medical professional coming into the home. Doesn't cover ADLs, activities of daily living, like cleaning, feeding. But if you have somebody coming in, a medical professional coming into the home, still zero. So the advantage plans, as I said, take an A and B, including Part D prescription drug. Every plan out there, even your current one, there's a formulary, a list of drugs that are covered by the plan, right? This one breaks it down into 3 tiers. Tier 1 is your generic drugs, so zero copay. Tier 2 are preferred brand, $1 copay. Tier 3 are non-preferred brand and specialty drugs, and that's a $1 copay. You can do 90-day fills in a participating pharmacy, and it's 1 time the copay. So for a 90-day fill, you're still only paying 0, 1, or 1. Right? You can do mail order. We use Express Scripts, Wegmans. I know that's not super convenient for everybody here, but you can do mail order either through Express Scripts or Wegmans, have it shipped right to your door. Still 1 time the copay, so 0, 1, 1.
So Kevin, talking
Yeah.
about prescription drugs, with the plan we have now, retail, pharmacy, drugs are capped at 30, a month, okay? If we do it mail order, then we can get a 90-day supply. I understand this plan 4 would incorporate, a 90-day supply available at retail. So if I go to Walmart, I get 90.
You can do it, yeah, at a local pharmacy, you can do it. Not every pharmacy does it, but most of them do now.
Well, the only reason
You can do a
Walmart didn't
90-day
do it
fill.
was because the insurance wouldn't allow it.
Yeah, But this you can do it at a participating pharmacy, and that's like, there's like 66,000 participating pharmacies across the country, so.
So it needs to let you do.
Yeah, Yeah, so it still would be one time the copay, whether you do it the retail or you do it mail order.
Right. So a question about this $2,100. I don't understand the language in that. What does that
Yeah,
mean? Does that mean if I go over that? If I pay $2,100 in co-pays, anything above that is covered, or does it mean neither? I don't
Yeah.
understand that.
so we'll go through that. So the cat, a few years ago. Well, actually, for a number of years, CMS has been trying to eliminate the donut hole, which you see the ads on TV a lot. Those are direct pay individual, got nothing to do with employer group plans like this. But they've been shrinking that donut hole down and they finally eliminated it. They also last year dropped the out-of-pocket max from $8,000 down to $2,000. This year is going up $100 to $2,100. But what that figure represents, it's not just your copays. There's other factors that go involved that accrue towards that $2,100 total. If you were ever to hit that, you're done paying and there's no cost share for the rest of the year. It resets
Okay.
January 1st.
And
So
the
it's a-
language was kind of.
It's really
Difficult,
complicated,
yeah.
and I just recently had somebody send me a real world example from one of our members. And who hit this 2,100, out of their pocket, it was only copays of $65 in this one example. The rest comes from, it's calculus. I can't even do the math on it, I have to have that sheet
Right.
and that formula to look at. It's very complicated. So it's not 2,100 out of your pocket. But every copay you pay would go towards that. And other factors go towards that as well.
So let me give you an example. Retired firefighter from Ithaca, good friend of mine. He's going through prostate cancer treatment. Some of his medications are in the hundreds of thousands of dollars.
Mhm.
And one particular injection was $157,000. Is this where something like that would kick in?
Oh, yeah, definitely. It will kick in for anything. You just might not get to that. He's
He's obviously one treatment and he's
gonna
Way
get to
over.
that, yeah. So,
so what would that mean in real,
and
Simple
also,
thought
but
for him.
here we're talking about Part D drugs, right? I'm getting a script from my doctor, I'm going to the local pharmacy. He might be doing infusions, injectables that might be falling under Part B, right?
okay,
So that wouldn't be part of this. But if he's going through all that, he might have some expensive drugs
right,
where he would hit that, and then his cost share is zero. Once you hit that, what they refer to as catastrophic level. But my point, part of my point here is, it used to be $8,000, they dropped it, so an incredible benefit if you're on the plan, right? You used to have to get to 8,000, now you only have to get to 2,000 before everything's covered.
mhm,
So as I said, there is a formulary just like every plan, and I like people going online. I have a hard copy of it if you needed to look anything up. But I like what,
It's like this, but.
yeah, no, it's not. It's only like
Oh,
this,
really?
yeah. But I like people going online to see it because that's updated instantly, immediately. I would say by the time I get printed copies, they're like, hey, we just added this drug, or this drug changed tiers. This drug's not covered anymore, so the hard copy is dated as soon as it's printed. But you can get on to Medicare, excelisbcbs.com and find that formulary. You go to, look for coverage through an employer group. And then you want the 3-tier formulary with prior auth and step.
I have a question that might be a silly question.
Yeah.
But the prescription drug formulary for the classic blue plan that we have right now, is
Yeah.
that different than the prescription drug formulary for a plan that's a Medicare Advantage plan like this?
It could be. I don't do the commercial plans like what your people have now. But it could be a different formulary. I always say if you're changing plans, get your list of drugs, check them in the formulary, see how they're covered.
Okay.
But I would say the vast majority is probably,
And that's where we
Similar.
are for the disruption
Yeah.
report, and, they've said it is the same, but they're getting us that in writing.
Okay,
yeah,
So,
yeah,
yeah,
Okay, and Advantage plans change all the time. Right?
no,
I mean, maybe not yours, but I mean, other Medicare Advantage plans.
direct pay plans do,
Right.
like, yeah, but this is
would
an
not change
employer
'cause
group,
it's employer.
right, right.
It wouldn't change ever.
Well, if Excelis lost their contract with CMS.
Okay, all right, so chances are.
Yeah, yeah,
Okay.
yeah, we don't change the.
So if we
plan here.
decide, Kevin, to enroll in this plan, it's not gonna be a annual enrollment that we have to do every year.
No, once
It'd be a one
you're
and
in,
done.
yeah, it's,
Unless something changes on
Yeah.
your end.
right, and in the plan, even for the employer group. The plan automatically renews every year. The only time I need something in writing. If the city said, we wanna change plans, or we wanna term the plan, whatever, then I need something. But year in, year out, it's in place. Every once in a while, there might be, if CMS throws out a mandate where you gotta have this on the ID card, we might have to reissue ID cards, but the plan's still the same plan.
And Plan 4 is a lot better than Plan 1, because originally we were looking at Plan 1.
Right, plan 4 is better. A lot better, no, but plan 1's very rich. This plan is, I've been doing this 14 years, it's the richest plan design I've seen.
Okay.
And that, that includes certainly direct pay, but the employer group plans are richer than direct pay plans.
I think the dental and vision coverage were lower on plan 1, or maybe not even.
I don't
They
think
were,
they
they
exist.
were.
Right,
They
yeah.
dental didn't exist, vision did, I
vision
think.
was, yes.
And this one's much
Yeah.
better, and also the co-pays won't weigh down on this.
Yeah,
I think the other one was 0, 5, and 10, or
Yeah.
0, 10, and
Yeah.
15 or something, and this is 0, 1, 1.
011, correct.
So,
So the other thing with this, it's a PPO plan or preferred provider organization. Normally, when I'm doing meetings like this for employer groups, I'm talking about in-network benefit, out-of-network benefit, which this has. But, and there's a difference there. Hey, you can save some money out of pocket if you go to in-network provider as opposed to out-of-network. This plan, as I just mentioned, very rich plan design, so it's what's called a passive PPO. In and out of network are the exact same. So it doesn't matter whether you go in-network provider or out-of-network, your cost shares are gonna be the same. So a lot of freedom of choice, going to doctors, and as I said, you don't need to identify primary care, you don't need referrals, you can go to anybody. We're Excelis Blue Cross Blue Shield here in this 31 county in our footprint. But the Blues are everywhere across the country. If they have a PPO model plan like we do, we can share each other's networks. So if you're traveling, visiting kids out of state, on vacation, whatever, you could look and find a provider. If you go to the nationalprovider.bcbs.com, find a provider. Maybe he's in network, maybe he's out, that doesn't matter. Even if he's out of network, as long as he participates with original Medicare, accepts Medicare assignment, and will take you on as a patient, all you're responsible for is your in-network copays, which are 0 anyway. Right?
all right, so one of the questions that came up, and in my position on it after doing the research is, if your providers that you're using now under our current health insurance program accept this, then at the new program, they will accept it.
Yes, so,
Still Blue Cross Blue Shield.
right, when providers contract with us, it's an all or nothing deal with us. You can't say, oh, we'll participate with this part of your population, but not that population. So if they're in for Medicare, commercial, whatever it might be. What else did I want to say about that network? Oh, so I always say if you're traveling, you're out, you're probably filling your scripts ahead of time, right? If you're gonna be out of town for a month. And if you're out of town or on vacation, you're not looking to go to the doctor, it's probably an urgent or an emergency situation, which is covered anywhere in the world, right? So the plan travels very well with you. Recently, we added a separate slide on diabetes care, because usually a lot of questions come up on this. Years ago, we contracted with Abbott for our diabetic care for our members. It was just a way to really save money and lower costs for not only us, but also the membership. So for diabetics, you're using Abbott, they've got a 1-800 number you can call, they got a website. But you can do Dexcom or Freestyle, CGM, the continuous glucose monitors. So it's and there's no cost there. The insulin pump is actually covered through a DME provider, and it requires a prior auth. And then the injectables, you know, the stick pens like those are covered through Part D. So that would be going to your local pharmacy, and it'd either be a 0, 1, or $1 copay.
Is this the only thing that needs prior authorization?
No, there's anything that needs a prior auth, your doctor's gonna take care of it. Doing the prior auth, you don't have to worry about that.
But are they always accepted? If the doctor says, you know, I'm authorizing this for
Yeah.
this patient.
He's gonna
and the
submit
insurance
clinical
is gonna
note.
Say, oh, okay.
Yeah, I mean, it's reviewed. I couldn't say 100% of the time, but on this, it's pretty cut and dried that if somebody's diabetic and needs a
Right,
monitor.
With this, but I mean about
But,
other
yeah.
instances.
Yeah, and the other thing I'd say, anything you're doing, like, all right, I got this surgery schedule. Well, you can do a predetermination of benefits, and the doctor knows what he's gonna have to do for a prior auth. They submit clinical notes. Certainly, there's a case here or there where something didn't get approved, but usually it does. If it doesn't, there's a way you can file a grievance, you can, you know, a way to go through it. Same thing with prescription drugs, even in the formulary. If you were on a drug that wasn't covered in the formulary, there's a way to apply for an exception to the formulary. Again, can I guarantee they're gonna say cover it? No, but it's worth, I've seen it work, so it's worth the effort to do it.
Okay, and the insurance they have now would need the same pre-authorization, no change there.
Yeah.
Okay,
Silver and Fit, the gym membership program. We used to have Silver and Fit for years. Last year, we switched to this other outfit, Fit On. And it didn't go well, so as of September 1st, we switched back to Silver and Fit, so. Our members that used to be with us are real happy this is back, but it's a gym membership program. No fee for your annual membership. There's over 15,000 facilities across the country. You can also, in the easiest way to find out if your gym, they'll have like a logo thing up there at the front desk or on the door, or you can call them and ask them. If your gym isn't part of the network, they want you to call and refer them, because they'll reach out and see if the gym wants to be part of the network, right? So you can 0 annual fee, or you can order fitness kits that get delivered to your home. There's one for Pilates and yoga, a swim kit, stretch bands, little dumbbell weights, a lot of different options. You can go that route, but they got a great website. They sent a quarterly newsletter, and again, that toll-free number there, you can call dedicated customer service. But a lot of facilities are in. If yours isn't, please nominate them, right?
do I look like I go to a gym? Come on. Yeah, come on.
Come on, coach, we used to play basketball. Coach.
And then the hearing aid benefit, another additional benefit we have. True Hearing is a third-party vendor we contracted with a number of years ago. We used to just do a $300 allowance per hearing aid per year. And a number of years ago, we switched to True Hearing, and you can see they got 2 different models, the advanced and the premium. The advanced, you know, you can see the retail cost there, $2,700 to $3,200. The copay is $499 for the advanced, or $799 for the premium. And that's per hearing aid per year. So still a significant number, but a lot less than if you were to pay out of pocket for those. And way better than our $300 allowance that we used to do years ago. But it includes comprehensive hearing exam. The way true hearing works though is you gotta call the toll-free number first. And we've had people do this the wrong way, you know, where they went to their provider they always went to and then came back and submitted it. It's gotta be a true hearing provider. So they do the initial exam, hearing exam, zero copay. And then you call them, they'll set you up with a true hearing provider. They include 80 batteries per hearing aid. There's follow-up visits for a year. So it's a great program, but it starts with the member calling True Hearing directly. Telemedicine and MD Live. So this is, you have this now on your plan you have now, exact same thing. We recommend people sign up ahead of time. You know, it's not replacing your primary care physician. It's certainly not replacing going to the ER. If you got a life-threatening situation, you're calling 911, right? But it can replace urgent care visits, or a lot of stuff goes through the ER that doesn't need to. But for anything, you know, rashes, sunburn, allergies, cold, flu, even behavioral stuff, right?
Pink eye.
Pink eye, absolutely. And the reason we say do it ahead of time is if you wake up middle of the night and you got a fever, you don't want to figure out how you gotta sign up for this, right? So you can either do it through the web, the app, text us, whatever, and get set up for that. Also useful if you're traveling, right? You know, you can do it and right from on the phone, and couldn't be easier. All right, so this is a new slide we added because we get a lot of questions after the fact. Geez, I got this letter, what's this about? So you sign up for this plan, you're gonna get a confirmation letter that says, okay, got you enrolled, CMS has you in the system. I mean, once you have that, it'll give your member ID. With that letter, you could go to a provider and say, member ID, while you're waiting for your card to show up. The ID card follows right after. That each ID card looks exactly like the one you just showed me, but it's gonna say Medicare Blue PPO on it, different plan. And then you'll get a welcome guide follow up. So if you start getting a lot of mail from us, yes, we sent it, and it's probably overkill, but some of it we have to send out. So, but look for that confirmation letter. And then contact information. This plan that you're joining through the consortium actually has a separate dedicated. This isn't the customer care line that the average Joe uses. It's separate for this plan. So you got a dedicated customer service line. I would say if you've got questions on benefits, billing, claim issues, whatever it might be, start by calling this number. If you don't get the resolution you're looking for, then you can reach out and track me down. But I'm out here doing meetings, not waiting for a phone call.
Is that in this?
That isn't, because it's a separate number, so write that one down. I don't think when we ordered these books, I don't think they've updated it yet to add this specifically for this group. But it'll be on your ID card. It'll be on.
These slides were forwarded to us, correct?
Yes, yeah, this, yeah.
The slides are also on our city
Yeah.
website, so
Great.
if you need those.
And it'll be, when you get your ID card, it'll be on the back of your ID card too. And then the member website to set up your account and everything, medicare.excelisbcbs.com. And social security number, which I don't think any of your people are gonna need to set up A and B, but if they did, that's the number for that and the website.
So people that eventually transition, then that'll be, they turn 65, Medicare eligible.
Yeah,
Oh, yeah.
yeah, those people will need it, yeah, but everybody that's on now that already has A and B in place,
Mhm.
yeah.
So what are the main differences between this plan and what they're already at?
Yeah, so I don't do the commercial plans, so I don't know everything about those plans. I do the group Medicare plans. So as I said, I've never seen a richer plan design. Jade might be able to pick out a couple of things from the current plan.
Or Chrissy
It's
can.
different, yeah.
So our current plan doesn't have the hearing, the vision and the dental included. So those are the
Yeah,
main.
So
the
then
add-on.
this is a positive.
This is better, yes. So when we said
Co-pays deductibles are less on.
are
this
less on this one, so when our standard for making any changes is equal or better.
Right.
This one is better.
Yeah.
The plan one was equal or, I mean, it was right there at the same line, equal better, but this one is definitely better. This is a significant improvement over the current.
So
Yeah,
how
I
does
gotta
it
point
save
out, there
money?
is no deductible.
So
on it.
this is
exactly
right,
what they're
so,
looking for.
so the way
Yeah.
we save money is when people are paying for the full Blue Cross Blue Shield plan. It's the same like if they were paying before they have Medicare.
Okay,
So the first 80 cents of every dollar is already covered by Medicare.
okay.
So we're paying 80 cents more for everything than that's already covered somewhere else. It's like being double insured.
Okay,
And this way, we're only paying for that second 20% that's not covered by the Medicare.
okay.
So we're able to actually give more and save money because we know that Medicare is covering that first 80%.
Yeah.
So that way we're paying for the additional and we're even bumping it up a bit because we can. So this is the way we want it to, I mean, it makes sense for everybody. And the thing is, these plans have come a long way in the last, say, 10 years or so from what they've.
Absolutely.
So it's something where if people had looked at these previously and they were not equal or better, and that was true at that time, but over time they've evolved to the point now where we can offer something that is significantly better and at a better cost. So we were really happy to be able to do this, honestly. Honestly, if I could get this for my own parents, I would, because this is way better than what they've got.
But I don't think this is gonna be the sticking point. I think the bronze plan is gonna be the sticking
Right.
point.
And so that's, and we've got meetings for those as well, but the reason, so what, and I think what people don't understand is with the bronze plan, we are fully funding both the in and out of network HRAs. So there will be nothing out of pocket for that. So that makes that better as well, because again, it's the same network that we currently use. It's the same benefits, it's the same formulary. That one's absolutely the same because it's still with the same consortium that we use at Tompkins County. This one's a little different consortium, but it's the same overall Blue Cross Blue Shield. But that one, what we're doing is when we looked at the actuarial reports of what our loss runs are really low. So by fully funding the HRA, the city is taking on the loss rather than leaving it with the consortium. And that's how we're saving money on that one. But we have a meeting for that this afternoon and 2 tomorrow as well, that you're welcome to come to and get those
What time's
explanations.
tomorrow?
9 and 4, I believe.
Okay.
So I'm sorry, I guess I didn't understand. What's your position?
I'm the director of finance.
Okay, all right, I didn't know that.
Yeah.
Okay, so that brings us up, one question about
Yeah.
the plan. Is there a cap on major medical?
No,
And again, I'll give you an example, because the Aetna plan they threw at us a couple of years ago had a $500,000 cap.
yeah, no out of
Somebody
pocket
getting
max.
cancer
Yeah.
treatments, like one of our deceased retirees that passed last year. Her medical costs went up to about $1.4 million by the time she got done.
Yeah.
There's no way that, a family is gonna come soak up $1 million worth of,
Right.
medical
Right.
bills.
Yeah,
There's no cap on this.
no out of pocket maximum, yeah.
And then the next question is gonna be is, I'm getting, my phone is blowing up, people are on, they can't be here, whatever. We have a large group under 65 that are not on Medicare that can't take advantage of this plan.
Right,
The bronze plan is the one that's been,
And that's a different organization.
talked around, okay. I
Yeah,
didn't
so that'll
understand
be-
that.
that'll
I
be
assumed that
today.
this was all encompassing.
No, we've got 2 different organizations we're working with. So, yeah.
So to make things clear, do you work for the Alliance? Do you work for?
no, I'm
Blue
Excel's Blue Cross Blue Shield,
Okay.
yeah.
Is there somebody from the Alliance that's gonna be at one of these meetings?
No, they actually felt that the information would be much better to come directly from Excelis.
Okay.
It's direct from the horse's mouth that way, basically.
Yeah, good.
So,
So,
Fair enough.
we did a lot of research, when the first plan came up in 2022, 23. You know, these advantage plans and that kind of like a dirty word when you're talking about this stuff for Medicare recipients. Because advantage plans get thrown around so much. And the majority of them are not what they're, painted as. This one seemed like it is, and I've said this word several times, say it again, I'm cautiously optimistic that this is a positive benefit for myself.
Yeah.
My wife and other retirees that are on Medicare.
Yeah.
But again, when you hear that word advantage, it automatically throws up a red flag because all the research that we've done says, no, advantage plan's bad, stay away from them.
And I think a lot of what you see is that people go out on their own and direct purchase them, and it's very different when it's done this way through the employer. And as I was saying to Pat before, they've changed a great deal over the last number of years. And I don't disagree with anything you're saying. I just think that things have changed and it's gotten to the point where it is not a bad thing anymore.
Well, I know the government is stepping in on some of these things because they're just, advertising is ridiculous.
Yeah, and the directly are
Oh,
significantly
everything.
different than the,
Correct.
even
And
though
there's
it's,
reason for that.
even though
because-
they're both Medicare Advantage plans,
Right,
the employer group plans have always been a lot richer plan design.
right.
This, as I said, is, the richest I've seen of the employer group plans. So probably any of the, anything you've heard negatively about MA plans has probably been a result of direct pay plans.
Well, the one thing that you said that, pounds home to me is that we're not gonna give up our Medicare to do this, because I know on some of these advantage plans, you give up that. And
you have to have original Medicare in place
But
to
you
join.
give up
an
part
Advantage plan.
B or part, whatever the other ones that we pay extra for,
Yeah,
and this other program takes its place. So the monies that were directed into that now go to this, whoever you contract with.
so good point. So you don't lose anything. You've got A and B still, it just gets incorporated into Medicare Advantage plan. But you bring up a good point that I didn't talk about earlier. So you're paying your Part B premium. And Medicare used to be paying claims, right? But now claims are coming directly to us, yet they're still collecting the Part B premium. They subsidize us as the insurance carrier for every person we have on to help offset the claims we now have to pay because they're coming directly to Excel, so not going to Medicare anymore. But everything you have in A and B, you still have.
Okay.
Yeah.
Well, that's
Yeah,
reassuring.
and you have to have A and B. You can't, you couldn't join the Advantage plan if you don't have A and B in place.
Right.
It
Well, I
used to-
know that when I turned 65 and then, one of the things that happened was, okay, you gotta buy this Part B. Okay, and it's
Yeah.
gonna cost you this much, it's gonna come out of your social security.
Yeah.
So it says, but it's an optional, okay, you don't have to, but. So I'm doing the homework and I'm going around office of the aging was very helpful.
Yeah,
They go, no, don't even think about not buying it, because
Mhm.
every year you put it off. It's gonna be a
Penalty.
huge
There's-
amount of
yeah.
penalty.
yeah,
to
and
get it.
it's not a one-time penalty, it stays.
I know it,
Yeah.
Crazy.
as the years go
Yeah.
by, it escalates.
But there are some people that, like, if you were, Medicare eligible, you're 65, but you're gonna continue to work. Well, those people can pick up A, they delay Part B until they retire, let's say at age 68,
Right.
then they pick up B.
So
So
if you're
it's,
collecting social security, and once you turn 65, if you don't take it, you're.
yeah, right,
And that
yeah.
was the underlying, all the feedback I got from all
yeah,
places I
Yeah.
investigated, so.
yeah. Yeah, and that it's a 10%. Of the premium,
It's a lot, yeah,
yeah,
so.
for every 12-month period, you didn't have it in place. So I've seen these horror stories where somebody got misinformed, didn't pick it up. And then a few years later, they're picking it up and their Part B premium is a lot higher. Yeah,
The Office for the Aging, and I know I've told Rick this, I went to them as well.
yeah,
And lovely young lady was, this won't cost anything, this won't cost you anything. And thank goodness a friend came along and said, don't drop your school insurance. And so I haven't, and it was very good advice.
Yeah.
Yeah.
What was she looking at, a direct pay?
Yeah.
Medicare plan,
Yeah.
yeah, I used to do direct pay years ago, and anybody that had employer group.
Yeah.
You don't need me,
Right.
yeah. But there's a lot of people that, you
Don't know
know, it's only option for them, yeah.
So this bronze plan is
That'll-
being bannered around?
That'll be this afternoon and twice tomorrow, so if you'd like to come to the,
5 is gonna include that.
no, it's at 4, before the one at 5.
Okay.
Because that's gonna be the sticking point.
See, we're not getting that information because all I have from Jay is,
She probably didn't realize to send it to you. So it's also on the website along with this one. We have those meetings. We had 2 like little banner things on the website. One that said if you're 65 plus retiree, you definitely want to be at these ones. If you're under 65, here's the other ones to please attend.
all right, so I need to disseminate that to.
Yeah, it is on the website.
It has not been, nobody knows about it.
Okay, it is on the
Yeah.
website and we've been trying to push information out about it. It's very hard to
So
get.
it's on the
to, but-
city website.
Yeah.
Um,
And I sent an email out to all city and current employees because it's gonna be for active employees as well. With the times,
4 o'clock here.
I'm double checking the times real quick. Sorry, I don't wanna give you the
No, I
wrong
get it.
information. I apologize. No,
Billing them.
can you see it on the,
I have a simple question.
well, I can't, oh, there we go.
So the bronze plan will be presented at 4 and it's gonna be followed up right after that with,
Try this again.
okay, perfect.
Yes.
So.
And that's if we can,
Yeah.
the more people we can come to get information, and if people want to Zoom, the bronze is also gonna be on the same Zoom. So it'll be the Zoom will go from the bronze right into this afternoon. I'm sorry, my phone will not work up here. I apologize. I can't get to it.
Is that bronze meeting